And 7 people have died and nearly 150 have been hospitalized in the past few days after drinking contaminated water in Madhya Pradesh's Indore. The state government has stepped up emergency measures amid criticism over the water contamination and deaths. As part of the emergency response, 4 ambulances and dedicated medical teams were deployed in Bhagi Rathpura. Separate wards were set up at the government-run Maharaja Yashwantra Hospital and the private Sri Aurobindo Institute of Medical Sciences as well. Private hospitals in the area were informed about the state government would bear the full cost of the treatment for all the patients. Chetan Seth continues to be with us on the broadcast. Chetan, help us understand the kind of emergency response that has been put in place.
देखिए, मैं आपको 2 बातें यहाँ पे स्पष्ट कर दूं कि अभी एक अपडेट सामने और आया है कि अब तक जो आंकड़ा 12 का दिखा रहे थे, अब आंकड़ा 14 पहुंच गया। 2 मौतों की खबर अभी मेरी बात बार की ओर से की जा रही है। हालांकि राज्य सरकार ने एक पूरी जांच कमेटी का गठन किया है। वो जांच कमेटी जांच करेगी और जांच के बाद आगे की कार्रवाई होगी।
All right, absolutely. So, of course, my colleague Chetan, they're giving us updates and, from what we're understanding, the death toll has already increased. Dr. Ishwari Rada, you and I have just sat here. You've just given me your first response, and in that interim, the death toll has already increased. I want to understand from you, because now it's important for us to talk about the immediate steps that should be implemented. What kind of medical care is required, because we're not just talking about 2 or 3 people, we're talking about 150 lives over here, and also help us understand the long-term impacts that come with this kind of infection.
We should stop VIP tourism to hospitals where people are admitted and being treated, because there is always from different political parties and from different leaders to go there. Secondly, you should involve public health experts who understand what is public health. What are the diseases which can be so easily transmitted, and what are the diseases which will require acute kind of care. So if some acute infections are happening, so if you do not know what infections are there, then you cannot manage. Firstly, you have to think of that. So there can be bacterial infection, viral infection, parasitic infection, and under this situation, once you understand what infections are there, we have to look for that. For example, for children, if they are there, the rotavirus infection is very common. And rotavirus vaccine India is an exporter for the whole world, and very cheap vaccine, and all the children are vaccinated. So particularly we need to make appeal to people that those children which are not getting vaccinated under this situation need help. Cholera or enteric gastroenteritis, it can drain children. They can become dehydrated, they can die. So hydrating children, particularly I am talking about children because they succumb faster than adults, because they don't have much liquid in the body. So if they lose through vomiting and diarrhea, they will die faster. So hydration of the children, understanding what infection can be there, stopping those infections, treating those infections, stopping VIP tourism, and all this knee-jerkism, suspending people, it is not a solution. Find out what is the cause basically. You do not know the cause, just 3-4 people are suspended, removed from job. That is not going to serve the purpose. That is not going to treat the patient. So, main focus should be currently treating the patient and preventing such kind of calamities now and in future.